In most states across the U.S., youth aged 12 and older can consent to their own treatment in the case of emergencies, family planning, drug or alcohol services, and mental health care. However, many healthcare systems have organizational policies that still require a minor's caregiver not only consent to services, but also attend appointments. Not only do these policies prohibit youth from accessing services, it also limits a teen's ability to advocate for their own health. These policies often result in awkward environments where youth feel uncomfortable having open and honest conversations with their healthcare providers. In fact, many youth feel stifled by their caregivers' involvement in their healthcare and believe they should have more control over their own healthcare decisions as they near adulthood. Introducing the Confident Teens Policy. This policy is a way for healthcare systems to foster independence for teens and create supportive environments that optimize a teen's healthcare experience. The policy is implemented at an organizational level and allows patients 12 and older to have one-on-one time with healthcare providers to discuss confidentiality as well as personal healthcare needs. This private time allows teens to independently answer patient health questionnaires and define confidentiality between a provider and a patient. Caregivers can join the health visit after the teen's one-on-one time with the provider, so they are present for treatment and all follow-up conversations. Here's an example of the healthcare experience when an organization adopts the Confident Teens Policy. During appointment reminders, the healthcare system will notify guardians about this policy to ensure that youth patients 12 and older are unaccompanied in the exam room for part of the visit, unless otherwise stated by the patient. When the patient arrives for the appointment, the paperwork is completed specifically by the patient themselves. Next, the provider will escort the patient to the exam room and take their vitals. During this time, the patient can answer confidential health questionnaires and discuss private matters with their provider. During the visit, the provider will discuss what is and isn't confidential, what will be shared with their caregiver, and answer any questions the youth may have. After this conversation occurs, guardians will be invited back into the exam room for the remainder of the appointment. The Confident Teens Policy and Practice will provide a stepping stone for privacy, foster independence, and allow adolescents the opportunity to advocate for their own health.